and some are a crying say, what the amaye and then homeda yimu. I mean, shroud. Naima, beautiful. My yahu yankodo, Namisame, happy Sabbath. The same time, let me maya kwaba about Health and Temperance Department. Remedia yedi na uchi munina. My ya kwaba about remedia eso. Na me adom ama na uchi munina. Onam adopter form penifo so. Achechire bibrebe. Enanso no onam ne bawa ba koso e de adesua kunini ebebre. Ye hia kese pa os minum no ye ne se. Adesua hodo a ye tie ne nyina no edi bedi dwuma na aboaye ametimi atrase ewo apomodin. Iti because na kopon nhira nyina se de yetimi beduru afidie yi so. Ena me sa kan biem se da me kan no ye ne e conference la no so no so conference la no so a abredwumade yi kosri na so busa asem a wutimi musa di mesre ye ne e conference la no so nyina se betimi dia me nyina ye mra zoom la yi so se de be ya abra doctor no de na no besi no se wasem bi se bi a yetimi ebisa o mention no so sa betimi aboaye na mema ene abra yan chen ho no na yakọ adwumadie no so no mesre ama opanyini diabo abo mpaye amaye eda diabo mesre so wo so a nanka o mitu ho na obo ye open prayer amaye
nanu ye mpaye odonfo ne obrohnofo e dia sedane aye ne na ase kese ma se wahwe yenso aboye ho ban ama mpo enedei akwa abetuyen yesade wase bio ewo won hyehyɛ pa wona monko aso edi amaye na wotwe mu nyina eja na wotwe adesua yi na adesua esom bo pa yi ewo yabrabom efisese nipa oho na seja ne hu nkentre no ne hu nsisi no ho so a nes wo yare a wosom kura no na ayedin enu ntibra sa abre wona monko aso na afi edi adesua se ye mayen sebe ye behwe hu so yie na yare ye bia nkebe hayen ewo ye nipadua mu na nka etimesi enyamsom ho kwae no ye da wase pass wa ye ne sa maye a doctor fo ahodo a wo mu wona monko aso no mu dia maye nsema kesi wo mu dia maye na wotwe mu nyina no ye sire nhira so nko ema wo mu
amen
ye sire wada sese eja wo mu bia hwiri bibi ewo bra obeye adwumadie yi mu a misre wada sedum bo a na ehye nanan se wo mu bibu adesiade ka adesade ka sie bi da na kuma pono so ewo na adwuma yem efa nimdie ekwam enam dimdie so a misre wada se eja emfa nimdie ne nkame no wona nimdie nyina firi wo nchen enti emfa nkame wo mu da ke nyina hu ye ne ye tie nso na gam ye ntie ne saakwa yemfamu abe wo mu na afei yentimi mfa mobra ese na efata enwumrei usanam wafuna aso esade adesua foforo sabre yen yesre wada seja sedi odinim de kase ma wona wo mu akasafo mu kasa etwemu no yesre o se enwumrei nso de obedi anim akasa nso eja domboa nen kasa efanimu na de odi maye no eja yenyam ntiase ese sebeya yenso ibitima edi aboye bra atotua homa bra boso ke nyina hu anwumrei ebra ya aso ayetie no ke hu na afei yinti mfanwa kumapem ewo wadom nti amen
amen opanyini eda wasipi awo paye kunna abo amaye nyamema ene se de nyina nim no ene ye eda a etoso ensia ewo yen adesua yimu se mo hwe ye poster no so a ebitum se oma etom safre mu nyina doctor fo nyina akasa na ka ba ko a ene on kasae ka ene ode ne dwumadie nso no ebebre na me sa kai se Yes, be a net ye there be. You may didn't pump on so in ano, a bear no china. Into Yenia yenye a conjure no, na me kais na point adoma. But china a humid and munina, na say that munina no, a pumudin ho and chile. And a real no man son, as I abode medina tofa. It's in a me case any conjure no, as in your SDA for no. Mom can say, well, SDA for Nanya, but the moment yes, I'm my so be number china. A no, let me answer no enya bichanimu chefa. Nene, nipa nyakopon ayina maye, wadi addition brain no. O you be a mekase obon homodren e wa asafum. Esa bon homodren e wo ne dwumadi ahodo a wodi enyina em. E mani ji pass nyakopon ama no so abedru. Tebia obedru emu. Na doctor na obedi enim no. Di kan no we first Ghana asafoba. Our tar boy youth pie, any enim de. So did makase e o youth for no emu. Ansana all school. Now we din kai in the first degree economics you pen. We no we dwuma kakra Wall Street. Na dwuma ye mu no ohunu se apomuden ya ade a ehu hia paa yi. Odo sikasem hu hia na enso no apomuden ezo hu hia paa. Na sikasem ene apomuden ena eko. Because se wonim sikasem hu nim dia ebeboa amayoto apomuden so no Into we na adwene se obegya sikasem na oye no na akotwa so akosua nipa ene yarewa enso ho inimdie. Iti samba ne call back biem you pen hono ma ne kosua ade ekowie medical degree hono na owie na anso no wo toa so aye de kasem ne kasem residency. I say one the first year of residency. Ayankopon ayadom enso no wabo na pai oye na 1 year owie ya o toa so Hopkins University akotoa so akoye hematology so no ho honamani yarewa akotoa so akosua no ho no nso enti na emaniji pa say enye ni patitusi a ode apon de ho nkyerɛkyerɛ ode brain na we obi a we single na ni da fom pa nso na yɛn pa boss na gopon bɛyɛ na dom na odi nweso nyina bɛkɔ wiye no wɔboa no na onya ono nso onya ne ho kani enti na nipa ode de sua ode brain no Dr. Mariah Agyei. Yebeka ya obi friend bu sam say ohu Owusu Agyei fo mienu ewo the program no so ba ko de Justice Owusu Agyei ana ba ko nso de Mariah Agyei ada omo ye warefo ana na me say o da bi nipa tu ko de friend me omo ye anuafo Nyankopon esira busua ne pai a o ma me ne Auntie Joyce ene papa Daniel Owusu Agyei omaya de se omabo asafo yi ate doctor for kese mienu a omo so ebo asafo no masafo no apomuden atimi asipi na me nhyira busua no na won nhyira ye nyinaa enso dwumadi ahodo a ye ma ahodo ediri nyinaa no ne nyinaa hu hia nya pomuden ko a dwumadi a obi ababia di bia no ehu hia Nyankopon nhyira asafo yi na won nhyira obi bia ti abra me de ma no esi no na se Dr. Owusu Agyei was so a Agyei Mariah so was so a message no so video no ya ma kwaba hi oh me too ho
Hello, can you hear me?
Yes, we can hear you now. Yet to say
Nyamiadom so it.
Nyamiadom boko and the other was it say first gonna force out to and suffer waba
Nyamiase.
Say drum boko dear
Nyamiadom yaboko.
Yoko Nyamiase. It's in the any pie better than cano Dr. Owusu Agyei Mariah. Nene obekasafa honam any yarewa ho. Bekasa kakra afa bleaching ho. Ene ebia se bebe mu dia ene make up ahodo ye nyina no kakra so ebeka ho amaye. It message say we dey ma no even remember ni nyina o say ya so na etire pa ye. And he say ebeboaye. Ene mesre ama opening Alex abo a team song no na esia na nipa betin nka Dr. Mariah Agyei. Na me nsida no nka homa onimidie na koso chechre saa woni din ni mu. Amen.
Amen. Amen.
You doing your best to turn from sin. You think you're the worst, but don't give up. You never know, you know your own. You'll be faithful to complete it in you. You doing your best to turn from sin. You think you're the worst, but don't give up. Never alone, you know your own. You'll be faithful to complete it in you.
He who started the good works will surely bring it to completion. Give it all your best and leave him the rest. He will do. Don't forget to read his word and lean him daily on to prayer, trusting every day on his promises. He will do.
You've fallen again, you've gone astray, but Jesus will reign if you give him your way. Calling to you to take you through. He'll be faithful to complete it in you. You've fallen again, you've gone astray, but Jesus will reign if you give him your way. He's calling to you to take you through. He'll be faithful to complete it in you.
The Bible tells us in the book of Philippians chapter 1 that he who started the good works will surely bring it to completion. So no matter what you're going through, be rest assured that your victory is secured. Why not sing hallelujah, praises to the Most High God who reigns on high, for he's worthy, yes, he's worthy of our praises. Hallelujah to his holy name.
We adore you, Lord. We praise you. We lift you, Lord, and we magnify you. We adore you, Lord. We praise you forevermore. You are King of Kings, the Lord of Lords, Holy One, the Ancient of Days, Almighty God, the great I am, we lift you high.
Oh yeah, Jesus. Oh yeah, yes, oh na oh yeah, Jesus. Oh yeah, yes, oh na
Abba Father, we want to say thank you for your love, thank you for your grace. We adore you, Lord, all the things you done. Follow you are loving, gracious, merciful, hey, Jehovah Jireh. We worship you,
Jehovah Nissi, we bow before your throne. Adonai, worthy of our praise. We lift your name on high. Ooh. Oshe Baba, Olua, Eradi, Bejiwaye, Bejiwamasi, Eremera, Elohim, Adonai, Shaddai, Okokroko, Bejiwaye, Onase, Ontonto, Jehovah Nissi, Jehovah Jireh, Elohim, Mawaso, Yawagesim, Bodi, faithful Father, thank you, Jesus. Our Jay, Yakutu, the sorry one, run us out, run us out, run us out. Pure Niwa, all He will be faithful, He will be faithful, He will be faithful. He will be faithful to complete in you.
Pani Alice Dawase. Marian, still all me too. And she said, a jail mount. I mean, car, morning, dear. Na on saw this album, let's only dinimu. Amen.
Amen.
Well, before somebody has your plan, why are dear? Or what's a Mobruno and Munyam? The bag, her first Ghana. Okay, one of the young people moves and rising up very quickly, sir. Now you are inspiration to the youth. Why are they pa? I mean, sit out.
Okay, good evening, good evening, good evening. Mama has let me share my screen now. Let's see, how does this work? Okay, let's do this one. But your movie screen, no?
Yes, you.
Okay. All right. Okay. Oh, okay, I see. All right. Okay. Someone tell me, Kadia.
You don't capa.
No, I'm sorry, screen, no.
You could be a camera.
Okay. Good evening, everyone, and happy Sabbath to you all. It is a pleasure. It is an honor. And then your topic, we're going to talk. We're gonna talk some dermatology, but the main focus is going to be skin bleaching, and this is one of my favorite topics. And I'm hoping that by the end of it, so outline of the talk is that first we're going to do some science, but can't skin, can't anatomy. If you can't skin bleaching, now you can't watch them no cry and no a day. Now your busa you also say skin bleaching no. Now say I never na say a action. If you want a historical perspective, how common is it? Meaning said, are we still doing it? And if we're doing it now, why are we doing it? If you have any examples of some of the products, ingredients, and what products anymore? Now you can't some of the side effects. And I think that happen was seeing we have to pay close attention. And then after that, if there's still time left, because I don't want to talk too much, then I have a couple of slides on pimples and eczema. So let's get started. So this is the skin, right? The skin is the largest organ of the body, okay? You can't organ, you can't brain, you can't kidneys, you can't lungs, but the skin, it covers you from head to toe, is the largest of all of the organs. And what is the job of the skin? It protects us from our environment, right? If the skin was not there, you think about, say, bacteria in them, right? And the skin is also important because it helps to regulate our body temperature. And see, let me get rid of this. Okay. It helps to also regulate our body temperature. So if you see the graphic that I'm showing now, we have, these are sweat glands, right? The purpose of sweat glands is say because your skin, your body realizes that it needs to cool you down, right? So then the sweat glands get into action, you sweat, and then you become cool. The skin also has a lot of nerve fibers that run through it. Some of these nerve fibers you can see a little bit here. So who can be who say yes, can be. Now this is how that thing feels like. The skin is also made up of 3 layers, right? And so you say you a piece of the skin, say now you share under magnifying glass microscope. Say you epidermis, which is the outermost layer. Then you have the dermis, and then the deeper tissues, right? So that's all the science will probably do tonight. Yeah, to us to know. We're going to talk about what is skin bleaching. Yaka skin bleaching a denier patchle. Also, skin bleaching is essentially said ofa soaps, ofa creams, lotions, when you name it. The goal of it is bibia tuntum ewo skin opese eye koko and also opese eye fita. Right? And the way these products work is they work by reducing a pigment that we call melanin, right? Also, melanin no, idea my skin no pigment na no, right? And so these specific products, they block melanin so that your skin appears lighter, right? And what is the job of melanin? Especially us Africans, free Ghana, the purpose of melanin is to protect us from the sun. It's to keep our cells, our skin cells, so that we don't develop skin cancer. I'll say abrofo, red, yes, your free be sunburn, right? However, us Africans, we have, or at least people of color, we have melanin in our skin. And the purpose of the melanin is to protect us from burning from the sun. And so when we use these skin bleaching products, says some melanin in your skin, we're destroying it, which means to say, am I more vulnerable? So much easier for us to get illness from just being under the sun. So I said I was going to talk about historical perspectives. Skin bleaching cry, and I say, even when we go back to ancient Egypt, you see Cleopatra, she used to actually bathe in milk because she wanted her skin to be white. She wanted it to also soften her skin. 3000 BC, a lot of the Greek women used lead. So skin no so be fita, right? And it's been there for a long time. Yabayanim Kakrebi, 16th century, 17th century, there was this idea of DNF, what constitutes as pure beauty. And no, the idea was said, pure beauty was so skin fita. And so some of the women, they would actually use, again, this lead-based makeup called Venetian ceruse. And they used it essentially to make their skin appear whiter. And we all know that lead has so many horrible side effects. Some of them are listed here. It can lead to things like renal failure. It can also lead to peripheral neuropathy, which essentially just means to say, skin because it's feeling numb. Or you may end up having like some weakness or something. So if we continue, by 19th and 20th century, adverts where I'm sure some of us have even seen it before. Yet me who said brony bi emma obi akwa tuntum way soap. Send boy obi use soap no ahofro dead na one home. In other words, your skin color na black no. Yes, sano send boy obi me koko, right? Yeah, twaswa, you who said by 1950s, 1960s, still these are some of the advertisements that were here in the United States, right? We have, at that time, the chemical hydroquinone was first created, and essentially it was allowing us Black people need to miss your skin color and more advertisements you see here. I said, Obako, that means that it's much easier for the men to come, men flock around her because of your coco or your fita. If you look at this other advertisement here, it says the nicest things happen to girls with light, bright complexions. And see, imagine, so what's at that time, what are you thinking, especially if you're someone who has a darker complexion? And you'll say, yes, whiter, cocoa, those are the things that are much, much more beautiful, right? These are still some of the advertisements that they were using at that time. Again, light and darker skin. Cocoa, you have to make your skin appear lighter. You have to make your skin appear lighter. And see, by the mid-1990s, then there was this campaign called the My Black is Beautiful campaign, where for the first time we kind of started saying to ourselves, skin na nyame, color na nyame dia boy, we have to learn to appreciate it, and we have to learn to love it. And we are all different shades, and we need to learn to appreciate the skin that we are in, right? So you would think, okay, so mid-1990s, after you drew 2020s, what is going on? But these are the things that we see today, right? Social Beyonce, Beyonce ko bleaching home, but Beyonce didn't two magazine cover swat. Yamania koko kakra. Sapa Pawe, your friend is Sammy Sosa. I believe he was a baseball player or something. Him too. You see on the door washada and on no I use a skin bleaching product so that he can appear lighter, right? And this is some of the global marketing. So imagine, young girl, young boy, maybe your skin is dark. Your skin is dark. You would think, oh, fita nefe. Here's some more pictures. It shows you fita nefe. On said social picture, on said the darker is going away and the fita is coming out. So the darker, the fita looks better than the darker. And see, these are all young kind of says subliminal messages. Oh, so let's talk about how common is this practice, right? Yeshua Michael Jackson, back when he was alive, this is when Michael Jackson was a young guy. And then later in life, he decided, right? This practice is so common. It's not just even, it's everywhere in the world, right? And then the other thing to think about too is, we always think, come beauty products, it's not just it's also men who also do it too. And as a business way, it's estimated to be worth $30 billion by 2024. Meaning, just buying these products alone, that's like the revenue stream in that specific business. So it's a big business. And going further into how common it is, I have some statistics here. Essentially, it's very common amongst African-American women, Afro-Caribbean, Africans, Hispanics, Middle Easterns, Asians. You can't make Asians, I mean China for ye B, Malaysia for ye B, Filipino for ye B, Korea for ye B, India for ye B, and yet Ghana for America. It is just everywhere. It will be beer. So why do we do it? What are some of the motives that are behind this? I didn't see. And your cream B, and as a soap B, send a bit in your skin color. No, why do we want to be fitter? Let me put it that way. So the first reason is dyspigmentation. You can't dyspigmentation. I may pattern a set. Sometimes the skin wash and torso style pet. Sometimes it's me who you share your skin, it's me who say higher cocoa saying ha, and that's higher fita saying ha, higher tuntun saying ha. And so sometimes they did a study, they found that a lot of people are very, very self-conscious about this. A lot of people also felt that because their skin no and torso sano, they felt unattractive. Yes, and I said, other people also feel like they get so consumed by it, thinking about how their skin is not as an torso. I hide one way, I hustle you another way. No, it makes them feel they get so consumed that it affects their day-to-day activity. And another point that I want to make is when we think about the definition of beauty, right? See a realistic definition of what beauty is. Let's just look in societies, right? And we can see that in certain societies, there are certain social privileges for lighter skin, or at least for whiter skinned people, right? So lighter skin is associated with power, it is associated with wealth, and it's also associated with beauty. So many research studies have shown this. And we have examples in society of this. I'll give you an example. See, I share the United States, for example. During the time of slavery, right? You had also blacks, at that time, some of the whites started mixing with the blacks. And so you had lighter, even though they were still slaves, they were treated very different from the darker skinned slaves. So the darker skinned slaves were essentially field workers, with meaning said picky cotton. And lighter skinned slaves, they got to work in the house. The work in the house is much easier than the work outside in the field where you're picking cotton. And one thing I also wanted to note, some practices, you see it most commonly in countries that were colonized by a white oppressor, right? For example, Ghana was colonized by the British, right? And Ghana was colonized by the British. British for ne buy it's not even cross. They are in a position of power. They're in a position of wealth, and therefore we start to associate their complexion with power and with wealth and with beauty. And before we know it, we are saying to ourselves, say, because that means say yes, you benya sika, yes, you benya power, yes, you benya yes, you fit. And let's dig deeper into some of these things before we talk about these products and then the ingredients that are in the products. So in the United States, right, study. This study was done, let me make sure I get the dates for you. I believe this study, it was published in like 2011, right? And essentially what they did is immigrants to say you buy it like you say free Ghana ban you busa nipa be 2084 and you busa their skin tone and their wage and we found so not surprisingly those that were lighter skin actually earned more than those who were darker skin. Up to 17% wage difference. Also now, sometimes we talk about the wage gap between males and females, right? And that's an ongoing debate. But even amongst different colors, and not just white versus black people, I'm talking even amongst black people ourselves, they still make more money, or those who are lighter, more fita, they make more money than those who are darker. And this is just among immigrants. This was the study in 2011. When it comes to marriage, this study was actually done by a sociologist at Rutgers University in 2005. And they essentially asked participants to rate their ability to marry as a consequence of their skin tone. Meaning said, based on what skin color, no, tell us, does it make it easier for you to get married, or does it make it harder for you to get married, right? Overall, study shows that darker skinned women had lower rates of marriage. Even in prisons, and this study even surprised me. This study was done by Villanova University, where they took a sample of 12,158 Black women who were imprisoned in North Carolina between 1995 and 2009, right? And it looked at just their prison sentences alone. And Tidame Pachene said, these were women who committed similar crime, right? I do jail in the same state. You would think, said, they should all have the same sentence because they've committed the same crime. But that's not what happened. The women who were lighter were sentenced to approximately 12% less time behind bars than their darker skinned counterparts, which is, it's surprising, right? It lets you know that even in the court system, the prison system, darker skin is still being associated with, it's being associated with all these things, and these women are still serving more time even though they committed the same crime. So let us continue. So these are the products, and I think that products really, it shouldn't surprise you. Why do I say so? It shouldn't surprise you because African markets are anywhere in the Bronx, anywhere in the US, and you see these products are there. These products are Clear. I think the first one, this one is Clear Essence. This is Paul Claire, Carol White, Claire Touch. The next set of products are Skin Light Cream, where they even tells you the ingredients that are in it: hydroquinone, tretinoin, mometasone, Skin Light, JRA. This is another one, Perfect Skin, Carotone, Dodo, Clinic Clear, Skin Fine. I remember when I was in Ghana, Kumasi, Oko Central Market, products here, and they're so cheap. You can get them 6 cities, 10 cities, which is like $2. If you bring it to US dollars, they're just so cheap. These are more of the products. Idol, Movate. This one, people like this one a lot because on set, so bleaching I won't sa and it will nine. Those are the two areas and should I into me and Danisa. And it's interesting because, and yes, I know a lot of people use these products essentially like Movate, because it has some steroids in it. They use it for their hands, right? Because they think, you sue other creams not and yeah, jumasa. But it's interesting because when you use these creams now, all of your body will change for the most part, but your hands and your feet, and then also around your lips also get darker. It doesn't change. And now there are injectables too. Yawo pania yitimi wo, any asaso wo pills I'll be timiano. This is an example. This is a woman who's of Asian descent, essentially. And these are, I remember when I was in Ghana too, I saw these things also being advertised on big billboards, right? So see, these are some of the other products as well. You see brownstone, I mean, you can read it all. I couldn't get some of the pictures of it. That's why I don't have it in picture form. But again, these are all some of the products that people use. So this is a slide that I want us to pay very close attention to. So first, let's talk about what are the main ingredients, right? I said because right? The main ingredients are hydroquinone, high potency steroids, and mercury, right? Are these products bad? They're not, because you can go to a besides the mercury, the hydroquinone and the steroids, these are products that we use in dermatology clinics all of the time. However, when we buy these skin bleaching products now, we need to remember that they are not regulated, which means that there is no governing body. Also, US, your FDA, right? The Food and Drug Administration. And their job is everything that essentially comes out to the consumer, right? Check it to make sure that it doesn't have any cancer-causing particles, and I said anything that could possibly harm you or bring any issues to you. But unfortunately, a lot of these creams and soaps, they don't have that. They don't have that same regulation. I know for a fact that in 2017, I believe, Ghana banned all of these products. However, in 2019, when I was standing in Kumasi Jom, I was able to see all these products. So the question is, how did they even get there to begin with? And it lets you know that even though Ghana would regulate it through sea and also by air, you still have border crossings, right? So these products are able to make their way through those coming from Togo by land and also those coming from Ivory Coast by land. So let's go to the adverse effects. Essentially, so products will use swab in Sunsan swab day and a bebro, right? So this slide is organized where you have each of the products, right? Like the main ingredients, and then below are the side effects that are associated with them. So I'm gonna go one by one so that I explain what happens. So we'll start with hydroquinone. Hydroquinone is very commonly used in a lot of these products, right? One of the things that it brings is allergic contact dermatitis. That essentially just means that your skin, you have an allergic reaction to it. It's who use a product now, but not why you're red, or you may develop some itchiness or some dryness from that area, right? The area where you put the product. Hyperpigmentation. That means to say, instead of some product, Emma will get a more fitano. It makes you darker rather. Corneal melanosis. Essentially, it causes dark brown spots to form in your eyes. When you kusuyana white, ubehuana brown products biababe tutoho. Exogenous onchronosis. I know your friend and Nen swab day. That is the scientific name for Nen swab day. Exogenous onchronosis. Conjunctival pigmentation, we can skip that. But then the other one I want to talk about is trimethylaminuria. So this specific thing, is essentially, we use to sell products, fishy scent. They smell, I said, fish markets, and that's because of the way that the product, the way it affects your skin, it causes you to produce this odor so that now you smell like fish. Impaired wound healing. This is very important, especially when you're thinking about one or more diabetes when we use that product way. because so diabetes already affects your ability to heal. So let's say baby shower, diabetes affects your ability to heal already. And two side is our product way called Kanhua. Now a bimutiminya crow in wood, and we've seen it just because they're using these skin bleaching products. Nail discoloration and then squamous cell cancer. Also, in the beginning, Nameka said these products work by stopping the melanin that God has given to you, right? And this same melanin protects you from the sun. Because what happens is when the sun hits you so much now, it causes your cells to, it damages your cells. And when you have damaged cells, not cells, it increases your risk for cancer, right? And so if you are damaging your cells by using these products now, you are increasing your risk for cancer, skin cancer. There has been one reported case of skin cancer from using skin bleaching products in Ghana. And I think that there are probably way more cases. It's just that we haven't reported all of them. So the other thing is mercury. Mercury, some of these products, products no, there was ingredients where because it's not regulated, they don't tell you some mercury won't. It's also mercury as we cramp or the mercury next skin. We talked about allergic contact dermatitis, hyperpigmentation. Mercury getting into you can make you a bit more bodam. It can make you anxious, depressed, and it could also make you a bit more bodam from it. Erythroderma, with skin now. So sometimes we use skin bleaching products are no red patches of red, especially red, acute tubular necrosis. Onset, the other bay your skin, no, rest assured that it is being absorbed into your body. Don't forget that. It gets absorbed into your bloodstream. Acute tubular necrosis has to do with your kidneys. So you'll think, how? Product my skin, and then it drew my kidneys, right? Keep in mind that these products are absorbed into your bloodstreams and they make their way into your kidneys. Acute tubular necrosis is a type of kidney disorder. Membranous nephropathy is also another type of kidney disorder. I'm not going to go into details, but again, the key point is these products get absorbed. Peripheral neuropathy, and it can cause you to not on side positive ANA, tremor. Yeah, steroids is swap. Steroids cardiac. It leads to atrophy. The main said your skin atrophy is essentially your skin becomes thin. Also skin no beginning you can say with layers means with skin no I had to paper. Also more use skin bleaching products. Should show veins. Easy because on my skin now are you weak? I am I had to say paper. It also causes striae. Striae is think of about let's say a pregnant woman who has given birth. On say because it has stretch, that's a stretch marks via. That's what we call striae. When you use steroids, so it can also cause acne, pimples. It causes cellulitis, which is just infection of your skin. It can also affect your eyes, cause cataracts, glaucoma, hypertrichosis, meaning say you have hair where you're not even supposed to be growing hair. No, you start growing hair there. Rosacea, and then adrenal suppression. Adrenal suppression meaning said your body makes cortisone. It makes its own steroid. And now, when your boost of energy, that's your cortisol waking you up. And to use outside cortisol, which is the corticosteroids, steroids, and that's a body, it suppresses your body's ability to make its own, right? And next thing you know, you're going down into diseases that you don't even want. And again, using steroids for a long time can also possibly lead to cancer. So I have some pictures of what some of these things look like, right? We can identify. This right here is an extreme case of Nensuo Bay. This lady too has that. I also said steroids can lead to acne. Acne, you know, you're trying to make yourself whiter, but instead you end up looking like this. This is the erythroderma, a little bit of the, now skin now a higher red. Once the skin is dry, kakra. This is an example of, this is eczema, which is a type of dermatitis, and then the brown that I said it comes into your, when you kusiano, na ubehuana hoswaya brown no. That is an example of it. And I have more pictures here. We bay na exogenous chronosis, and then you also have pimples that will form. And these are not baby pimples, these are big pimples that form because of these products. So again, you're using mercury. Sometimes it doesn't list it on it, except mercury now we use, but you're using mercury, you're using hydroquinone, and you're also using steroids. And I make us say not striae. On say stretch marks usually say a man will not their belly stretches and then it's on their belly, but instead you have it on your arms. It also increases your risk of infection. This right here is a fungal infection. It's called tinea. Right? Not kakraka. So this is the end of the skin bleaching portion. And I know that I want to make sure we also have enough time to ask questions. So I was just going to talk very briefly about some other topics. I was told that I should talk a little bit about cosmetics, makeup, not saying, because makeup is like a big issue now. So some of the key ingredients in makeup, we have water, emulsifiers. Emulsifiers essentially allow for, I said, water and oil, but emulsifier allows them to be able to mix together. Preservatives, they prevent bacteria, they prevent mold from forming. Thickeners make the makeup thicker, and then moisturizers, emollients. These essentially moisturize your skin so that water in free with skin move. And then makeup also has like colors and fragrances. And then I was going to talk very briefly about some of the products. But I think that I know there are people who want to ask questions. So I will skip these really quickly. But say I'll be happy to come back to this. Because I think that now we see a lot of, paraben-free, phthalate-free, aluminum. When we think about deodorants and stuff, these are some of that. And then I know that some people also may have questions about eczema, because eczema is very, very common. And I think my last slide is on acne, and then I also have some slides on anti-aging and Botox. So I'm not sure if I should proceed.
Madam Twaso.
Mentwaso.
Na you say questions no.
Salmon. Okay.
Yes.
Dr. Maria, yanko bebia ye ofie nti bomodi a chire yen wate. Ye hia pa nema wo kan ye hia pa papa nyame hira o de chire nya botre yanko bebia.
Okay. Okay. I guess let's talk about the eczema. Because I think that a lot of people suffer from eczema. It's very common. Some of the risk factors is if you have a family history. In medicine, we have this term is called A to B, right? And it's three things in one. You think of people who have A to B usually have eczema, asthma, and seasonal allergies, right? And so if you are somebody who fits in this, then you're likely to have eczema. And then you also have those who have a loss of function mutation in a specific gene that is involved in skin barrier function. So those are the main risk factors for someone getting eczema. Eczema, it is itchy. It's more common in children. Elbows, essentially wherever you have creases, right? Skin creases, flexural surfaces, meaning elbows, underneath your knee, baby, a whole bend will be. That's where you'll find, that's where eczema likes to be. It causes you to be very, 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 very itchy. You're essentially hyper-reactive to everything in not to everything, to some things in your environment. This could be certain foods. You're itching so much. It could also be certain soaps, lotions, and cleaning products. So how do we treat eczema? We treat eczema with steroids. Also, my steroids once, and I said steroids, no. We have a way that we use it, but when it comes to skin bleaching product, they go overboard. So that it also everything in moderation, right? That's the slogan, everything in moderation. So we actually also use steroids a lot in dermatology. So we treat eczema with these things. We also treat them with medications that we actually use for cancer, tacrolimus. Or at least not for cancer, for immunosuppression, to bring especially in transplant patients, kidney transplant and things and liver transplant, sometimes they're on these medications called like a medication like tacrolimus. So we can use that for eczema too, depending on how severe your eczema is. And then Dupixent, this is a new drug. I think if you watch TV a lot, it's a new drug that's been on the TV a lot for eczema as well as for asthma. So that's my quick, I know people have questions, so that's my quick bit about eczema. Another issue that we also always have is acne. Whenever people think of dermatology, they think of eczema and acne, but dermatology is so much more. But acne is a combination of 4 things that are happening that lead to the pimples forming on your face. And the combination of follicular hyperkeratinization, sebum production. Sebum is just oil production in your face, bacteria, and then inflammation. If one leads to the other, we don't know. All we know is that usually when all 4 of these things are happening at the same time, that's when you're likely to have acne. We also always ask, some people say, me di chocolate na afe me pimples. And I said, me di merin katia na pimples aba menim. Me di ejani a sichle won be brana. And I said, me no milk na pimples aba menim. So far, there aren't any studies that have identified a relationship between the food that we eat and acne. So hopefully, we'll do these studies, but it doesn't mean that one doesn't exist. All I'm saying is there are no studies out there. And the way we treat acne, because people always come asking, I need to get these pimples off my face. Especially because I remember when I was growing up in my teenage years, that's when I was like 13, 14, I had so much acne. And the way we treat acne is, it depends on the severity. It depends on what kind of lesions you have, whether you have, I say, bumps, and I said bumps, I don't want to be woman. And I said, be also to me where I have a picture. The answer, this acne, said this one, these are different way acne I can see right? So depending on the kind of acne that you have, that's what determines what kind of treatment we're going to give you. So some of the treatment options are benzoyl peroxide, azelaic acid, salicylic acid, retinoids. These are all different medication classes that we can use. Some people, their acne is so bad that we actually put them on antibiotics for some term. And then this is isotretinoin, that is the big gun of acne. And so your background, if we put you on this medication, we essentially tell you you have to even be on birth control. You have to be on 2 types of birth control. because this medication alone, no, God forbid you were to get pregnant, it can have some really damaging effects on the baby that's growing in your uterus. And then I know that a lot of people also have questions about like anti-aging and Botox, because that's kind of the new trend now. And the two things I want you to get from anti-aging is number one, the number one thing that ages our skin is actually the sun. The sun is responsible for increasing cell turnover, right? Na wrinkles, and then it causes damage to your skin. The skin is changing, and then the skin just continues to age. So dermatologists always recommend that you use sunscreen, which is something I think that Africans we don't use a lot. But sunscreen is very good. And if you're gonna use sunscreen, you always want to use SPF 30 or higher. We don't do SPF 15. Every dermatologist will tell you to always do SPF 30 or higher. And then the other class of drugs, retinoids, they pomasum. We use them for acne. We use them for so many things. It's also been shown to be very helpful in slowing the development of like wrinkles. And people also ask about Botox. I won't say who, but I know when I said I was going to do dermatology, so many people said, "Oh, I'll come to you for Botox." Botox is not scary. It's essentially a bacteria that we inject into your skin, and it causes that area of your skin to be paralyzed, right? Because paralyzing it is what allows it to not move and not to have wrinkles form. So you see that if you see a lot of like the celebrities, their face always look young, right? And we know a lot of them use Botox. And what we're finding now because of social media, at first, when they Botox, late 30s, 40s, 50s, and then they would come for Botox injections. But now, because of social media, because of all the pictures and stuff that we're seeing, all the influencers, everyone wants to be, somebody on social media. And so you have the 20-year-olds, the early 30-year-olds. These are the ones who still have like young skin. They are the ones who are also coming for these Botox injections. So that is where I think that's all I have. So I want to leave time so that people are able to ask questions. Okay.
What's Minka? Okay. Dr. Owusu Agyei de wasipi ewo adusua wodi amaye. Ye abia ehu hia pa de wase. Yise obia afumu aba na mbise boye nyina. Nyema ansa na memba kwan na ye questions ne contributions no aban. Titro bi o lie so ampese ya kunoji wo mo na afie de questions ne contributions nyina so no aba. Yewo Dr. Paul Yeboah ewo lie so Dr. Boye pai Dr. Nyamin Style so what we do lie so yewo Dr. Thompson I think Tuesday no or lie so yewo Dr. Samuel Owusu or lie so yewo Dr. Justice Owusu Agyei I Mariah Agyei so lie so and yewo Dr. Owusu Frimpong Presla so edo mu nyina amwase se otobedu lie so ene adusua amode amai na minsa mu pi na ansa kra no mefre se Dr. Yeboah lie so a wasa ka kra bi opese oka ekire na afide obi a na questions ne contribution no atwa so na Dr. Paul Yeboah Mr. so buti en mi tu ho a doctor no am ya to nka
ebusuafo da mo ase bebre I think I owe you an apology. Brat for Mr. Dansomode Ade Bremeno. And I'm retirement in Tinam Casa next week. Timothy Hosa may train my next week. Ban runner. Kwasiboma mania. And tin run the first time on my course. But when you say I will never miss this thing for anything. There be a cockra 80-year-old in the Janasu Chakrodo. Now to see Yania money and Nananum, Yinko say no. I have your church be na Mako Jenny Nina. Me knew Matthias and the Eddie Canning and to say the Anang here the Yamiasi be brave. Family Susunya Shiramo, Mabo Modern Bebre. Presenters in supreme mature presentations are Modia Mana, you're a church bebre. Minya less than Namiana missing Napasako, they are official doctors saying, free him.
Open you down so
Free New York Church.
yes.
I'm so wow.
Amen.
Mamma do uncle school na suya. Some children kunya numere man. Na mumpanyfo mo apma twede a. But a men cafe da meba mo hono was ma me nambeka. I said the New York Church ma restore me faith. Make I say 1980s near called Cockum meeting be. New York delegation name paying for no be econo. One say, can anything good come out of Nazareth? But as I said in New York, I restore your faith in two ways. One,
Amen.
or dear boy, Simo Sodano, Coveti Tami, Sika Mu Sana Maboso, or the Babu and Yamejuma. More than someone said, the Akura made the Bechamo. And then this week is only a Yahuni. I restore your faith for New York Church, but above all presenters, no yadamwasi, more prepare mature presentation pa. You better find link in the near tier. Na mesra presenters in say mama opportunities at this mama body some of link more presentation towards the spirit of prophecy. If it's a mammy white to say a break why we meanwhile, be close to all avenues of spreading the third angel's message, just a health message. Musi tend to say the any hour New York or some more kanyam, so Munya Karaba Kunkura, Yamin one about yesterday, but more health. Now more the fat and yam some camusua will be win if I be brave. So far, there many presentation no wasn't be I dare by come, I catch him so all the knowledge. You made the amay and when in faso set one fine your practice at. Send your auntie came. Channel fire a dear proposed skin now so a band by when you now feel someone image in an office is a madra 1 year day. Yes, more than near your mage day and moment put it into practice. I dear by come a person may one a tearful. Afidie so krom ha emra na ye adwuma wo doctor wakono ho no waye wa x-ray waye wa MRI no watwen moja mu ahwe odwunso mu so onya difficulty in diagnosis now begina afidie so say me say ni say na doctor de na ha me so what de wo ya de na betudwa wo nipa nyina nim say ya dan so no na ye ho be kire wo no say ne wo no ye program. Secondly, yes, see, one month a variety of physicians. So people have what overcall now, so how calling a number. Now, what corner office I could register with any. If he says a doctor, no courage and FDA, so mal prescription be as a coto way up. You know, I beg a license. If he said, I buy one, she shares as a won't call no office. Man, in free won't share one woman wardrobe until Ghana for. Mommy, I hear yes, paying for your opportunity to present to be to say, HIPAA laws be or her. Ni Panama or on to me, or ya dear, infantuja. New York for say the more restore your faith. Something greater can come out of Nazareth. Yeah, the more be.
Oh, Dr. Yabua, and said there was CP. Any Dr. Poyabua, no, or one of a nipa or my boss are free with Apomodane and Chere. Any asafui aboma safui so silver pie. They be all boy, Bekaya. Last year, November, no, by the man, Chere, a far COVID, the whole no matter how do I be a bit me and your COVID in raining. Dr. Yamin said out, Uncle Samo, patent in my non tongue condemn, and they be a fab boy, sir. But you for young chair hono, and a mestre ama Jenny, your questions no. But my pajamas, sir, I will a so Zoom no so, and now say, with me at the question no. Abba, you're very ready. Ama Dr. Agyei at me answer am I. You say Zoom question reading can buy as no we pick answer. The first my pick Zoom question no. Na we are na nipa the no ye Ghana aye hot na odo question no and so no Abba.
I open you down so me about chawa with your mommy justice ni mommy correct here dibi wa has see why me pauchaw. Your Dr. Yabua kind of truth. The only thing is prescription now so telehealth medicine, which my wife does. In the state of New York or any other state, they can do prescription over the phone. I send it to your nearest pharmacy to you. Small channel because ABR or CASABR, they cannot prescribe over the phone. No? Maybe people will get it wrong. Telehealth, no? They can prescribe it to you over the phone. Given say be our register with the doctor, no small. Very important. Your kind everything is okay, but that when it comes to telehealth, there we can prescribe it over the phone. Given say we are a patient, send you confused or because of COVID in the quarantine and very popular, where you don't have to see your physician, but they can still see you virtually and then send your prescription over the phone to your nearest pharmacy.
Yo, Dr. Osil Tutu Yedawase. Bijisa Dr. Poyabua ka je afa ezumi de hona okafa. Say say be a be kan adro ye presentation. Telemedicine there. Idea or you also cannot operate. That means that or clarification also or the aba. And you quite a question.
That's it. Ghana for because natural baby kakrama me. Koyene patient answer. So when any patient or true baby mount, brown sa and papa. But anyway, some movie pretty here.
Yo, we say in United States, Dr. Edwase. And yet, you call Yensem Bisano eso. Dr. Usuna will be with us say Botox no anti-aging creams no recommendable. Say we use those products now.
Let me say this. There is nothing wrong with using those products, okay? But it is on a case by it's your own, it's your body and it's what you want to do with your body, okay? And what I mean by that is, yes, it's like taking a pill, a blood pressure pill, right? Or taking just any antibiotic. Everything has its side effects. Everything has its side effects, right? So I'm not saying don't use it because you don't want to, like if you feel like you have the money, you can afford the Botox and you feel like you have some wrinkles and you want to fix it, please feel free, right? There's nothing wrong with it. But just know that everything also has its side effects.
Okay. You said the busa question what say as many ubi pijaran sa na or pakwan start to meaning so busa question there now the junior Ghana aye hot meaning say ni para busa question other than that and you mefre opinion kwatin ameniam hon opinion the question aba
Bacho masembusa eni enku a yede eka ye nipadua no se ye na ya recommend ama ye nko a ye apply to ye nipadua na se na ye apply no ye te kakra bi ana ye te bebrebe minim how besi achirim amama sem menya man na secondly me hu se oyi nku bebrebe eto ayi mfonyini ni so nti me azumu se nku a wanyi bia no it means say good. That is my assumption. Na me say cocoa butter na nkuto me say eno de eye a how bia ni hu se yisu a na sign ene so sitie.
Yeah, so enkuto de nyame de che Ghana for, and it's something that we don't appreciate it enough. Oh, because enkuto it has so many nutrients and so many vitamins, and it's so good for your skin, right? I think so some of us yempe because of scent, and also sometimes because the thickness of it, But so most products, I share lotion. Sometimes lotions are used to. Natural ingredients, you'll see that one of the ingredients is shea butter. Okay, and so I would say in kuto, any cocoa butter those products are fine because they have good nutrients in them. When it comes to say how much of the lotion should you put on your skin, and that's person to person dependent. For example, eczema, they have really dry skin, right? They have to apply more than the average person. So it depends on your own skin. And see, next time, doctor, whatever lotion I will prescribe amount, I always say how much. Now, also because I don't know what your skin type is, and I also don't know how much you need. And see, next time we say how much of the lotion also the yo.
Obi elkese question bia benwe na me musa ento aso na afide me san come back to chat nbi akono o say o skin products bi na ade eje no na no isu bi foforo na eno ama na skin na etuntum kakra but we do use ye no ama na skin no eye light do be say na ono ombriti de but o the same na skin na light kakra eno no so no ye sera wakafa ho.
Sir, I know it depends. Ingredients benu.
I don't know.
Yeah. Maybe the minister pananka. I will look at the ingredient list, right? Is it any of the inkunam de tools or no? A beer. Say a beer dia you should stop. Because the truth is those specific products, no. There's no way to know what the exact ingredients are because, like I said, no, they are not regulated. Okay? They are not regulated. However, this is a product that they got from, a reputable pharmacy, reputable place, so we can trust what the ingredients are, then I have no issue. But again, what are the ingredients? Now, so who said hydroquinone 5% woman, you should stop. If you see, some questionable steroids in it, you should stop. Okay?
Me say any pano ate asembisano ase. But the next question to Reba. No be busa say bleaching, you bit reverse. Is it reversible?
It depends how far along you've gone. So let's say you've been using it for let's say 2 or 3 months, right? It's reversible because as soon as the skin is always turning over. Every day you're shedding skin, you're making new ones. You're making new cells for your skin, right? However, sometimes if you use these products for a long time, and I'm saying years, right? Stretch marks and those things you cannot reverse. Nenswabe is something that cannot be reversed. That is the point where your skin has been damaged too far. There's no going back, right? And the problem with Nenswabe is that most people continue to apply the bleaching cream thinking but if anything, it just makes it worse, right? But I would say definitely. Bleaching, it is reversible, but it depends on how far along you are in the process.
Oh, okay. You say ni pan atiase. Na ni pakona na say beside say how important is SPF and the doses that are good in terms of 20 and 50.
Okay. So like I was saying, sunscreen is something we don't typically use. I say emrofunu no mute yusu because like I said, your melanin, which protects us from UV light and from the UV rays from the sun, right? Almost need protection no. Into omuko jina eriemu ana omadane eyi ubehun, they turn beefy red. They get sunburned, right? But when it comes to SPF, no, we always recommend 30 and above, right? You can use 40, you can use 50 if you want, but so long as it's not less than 30, it's okay.
Oh, yeah, that's it. And my friend Asmara Amonaba. Asmari. Okay.
Yeah, okay. Me that say, me person me busa about Mercy cream and Chocho cream. Yeah, I turn Ghana. Because me guys am Ghana and me skin problem be. Me used to be my no koi. It didn't bleach my skin or whatever. But me manu skin problem. Eczema. My try you call doctor no or my corticosteroids no. It wasn't working, and also I knew that using too much of it so wasn't good, especially when we are kids now. But Nancy me try with Mercy cream now. Within about 2 days, and I've seen say something is working on it, like skin not changing. And I'm basically about Ghana. Okay, Ghana for I click on my brain. So what about Chocho cream, Mercy cream, those products? Me that's it.
Yeah, thank you for asking that question. It's I know that I have to take it with me and get back to you because to be honest, I don't know the ingredients that are in those specific products. Okay, so I know that I'm writing it down and I'm going to research into this, and then I will definitely give you an answer at another time. Why?
That's it.
I mean, that's no question I will say. Now we will say with na kasakra afa makeup some bisa also kakra fa ho. No bisa ebisa. Timi ni ebia nipa no epeso kafa ho bi mu de.
Please. So I guess the question is what is the question about makeup?
Oh, be sure obusa say effect bi of so na hwa sa no be purpose.
Right. So I think that there haven't been enough studies that look at the long-term effects of using makeup. Right. And so I can't say whether it's good or whether it's bad because there haven't been enough studies that have commented on it. So I can't really comment on makeup.
Oh, yeah, that's it. Na me de kakabia me meka atu nyina fo say nam se study em my no o yusu ana ko de wadwene so ato ho na se be ya e bia akire no e be ka se bi boni bi o ma na enko ha zi se eni da ho no bibia be bia normal near dey ada ho na o yusu too much na it se boni bi o ma ankofa yusu anso bia so dey amba so in case research ba na se bibia ni mu a asmu fine but se bi so manam se wa yusu too much and so assume dey asmu fine ti nya careful akra still be boy.
Let me say this though. I think that we have to this all goes back to what are the ingredients that are in the product, right? And some of my slides I was going to talk about this, I forgot. But some of the products that are in makeup, there are parabens, there are phthalates. Some of these products are very heavily regulated, right? Because some of them can lead to like they do have cancer-causing effects, right? But then it goes back to the idea say makeup now will talk cheap, or you buying the expensive brand. And then even if you're buying the cheap or expensive brand, no, it's the question is also how do you even know what the what ingredients are actually in it, right? So I think that it all goes back to what are the ingredients? Are these ingredients linked to cancer? And I think that usually the cheaper makeups, no, probably don't have the best ingredients in them. So that's what I can say about makeup.
Coordinator, Mr. Danso. Hello? Yeah, me pacho, me contribution kakra. Me me kase. What kind of Lengin White books are? Say you for no be brain, no, do 16, 17, then they go into makeups. But nice face, nice skin face cry. Who are starting your makeups? And your Bible no Lengin White, any spirit of prophecy. Who read the books now? See a toss of books in the ma. Your friend, you for no. You talk about makeups. Why we are not supposed to put it on and why we should desist from it. And see, I don't know, says all this maybe bit me, afasa teaching no akasa one because it's not good.
Yo, Mami Lisa, but was a passer or day as same way about now contribution is very good. I read a mere to myself, youth department. Discuss it. Now, one of those things a person youth no can was get was a pa na means now, maybe the hujuma. And it may frame one plus and so I didn't need your abba.
Hello.
Patrol with Macassa.
Actually, my question here for birthmarks. If mother gives birth to a child and has the child or the baby has some kind of a skin pigmentation, or I don't know if it's the process of during the melanin didn't form completely, or I don't know, but papa no ne mama no mu misa birthmark but not akwala no either send the face back, some part of the body didn't form right. None is skin, hot skin, or a very fair skin or light skin. Sometimes it even looks like a burnt skin bisa. And also know what is that about?
So birthmarks, I guess there's no just because your mother had a certain birthmark doesn't mean you will also have that same birthmark, right? Just because your father had a certain birthmark doesn't mean you will inherit that one too. So worrying about birthmarks that I said, when we're thinking about birthmarks, we're usually also thinking about like moles and stuff, right? And this is more of an issue when you're thinking about lighter skins, because you worry about how that specific like mole is going to evolve, right? But birthmarks for the most part are benign. they are benign as in there isn't anything wrong with them.
Okay. You say what's it? And you back to your chat, so na ibusa question na Ghana woman no ibusa say kuku better ne nkutono and coconut oil. You good mouse skin and this all can happen.
Bayman Patron, next question. Can I add something to the birthmark?
Okay, contribution there with my yeah.
Patron contribution. My Patron birthmark, you know, also like what color it has to do with a lot of genes, like goes way back. And maybe as your great grandmother or any of your families from way back, or your spouse or not, had a certain birthmarker, it's possible for your child to also have birthmark as well. It doesn't mean both parents don't have to have birthmarks for your child to also have a birthmark. It goes way back. All the skins that put together is not just from you and your husband, but also from the ancestry line, you know.
But I think the key point is that just because they had a specific birthmark in a specific area does not necessarily mean you will have that same birthmark.
Yes.
We also have to understand that birthmark does not necessarily, it's not a bad thing, right? It depends on where the birthmark is, right? Because sometimes people can have birthmark in a, you know, a place that may not be pleasing. Some can have it over their eye. It can be over certain different areas of your body. And in some cases, it may need to be taken out, right? But for the most part, which is what I was saying, birthmarks, for the most part, there's nothing wrong with them.
Dr. Edwase, and I'm Mrs. Edwase, no contribution. And you walk back to a chart, and so now you next question. Na obi busa say makeup powder and makeup powder on the skin. Say you said another one na so bisa baka.
It seems everyone wants to talk about this makeup powder.
This time, you know, I don't think it's be a young photo this time, you know, and only idea about so far.
Right.
Yes.
I think that somebody had also written in the chat said it can clog up your skin and it can also cause acne and all of that stuff. These things are true, right? But you also have to remember
that was me.
There are ways to, you know, go around all of this as well. Okay. So I don't want, I guess let me just leave it there.
Okay. Did you say Dr. Priscilla also from Pong so forget sir? Am I the crime? If you have this more contribution you will be or the other. But also from Pong, which one will meet too? Okay. On your ready, I mean, Befre. Oh, Dr. Butakasa.
Hello, Mutiminka.
It's Wonka, yeah, I've read Wonka, yes.
Mariah, it's me.
Hey,
thank you for coming and sharing your knowledge. This is an excellent program. I had a quick question though. I've been seeing a lot of patients and doing a lot more dermatology, and especially with Ghana Fono. We're not used to, like you said, and use sunscreen. Now, one of the reasons I find I'm from sunscreen is that when they use the sunscreen, it gives them a white cast. As it's like this white look on their face.
Mm-hmm.
And so I've been trying to look for brands that do not give that that white cast on the face. And I found some, but I was wondering if you, as a dermatologist, have any recommendations as to what sunscreens don't give off that cast. And then my second question would be children. What recommendations in regards to sunscreen, what brands would you recommend so that I can also recommend that for my patients?
Hello?
Yeah, I've read Wonka.
Okay. Crystal, let me, because I have a list of it on my computer. Let me do this. Let me send this to you after the presentation.
Okay, awesome.
Would that
Thank
be
you.
okay? Okay.
Yep, that's fine. Thank you.
Yeah, me say obi so attract back chat and say na no see on so question.
Yeah, let me.
Obi so answer to the same question. You know,
right.
I don't know. Be with me as summarize it.
Maybe she could screen share it too.
Okay, let's do this. Let's jump to the next question, and then I'm gonna look for it, the list on my computer, and then.
Okay. All right. That's it.
Okay.
All right. Your next question, no, so. Obi busa or sister fear. Because SPF brand ben I recommend the amama.
I think this is all along the same question. Because it goes to the fact that Black people, whenever we use sunscreen, it creates that the white paste on our skin, and that's why we don't like it.
Okay. Now, obviously, or dry skin pint, you know, or had the oil, bit is olive oil, ni vitamin E oil, you gonna lose him. Now, opposite who say a too much of hot skin and
Or you said vitamin E.
Vitamin E and the olive oil more you gonna lose him.
And so they're asking.
Opposite who say a too much.
I mean, it depends. How does their skin feel? Right? Because a lot of these things are it's specific to the person. So it's hard to say this is too much or it's too little. So again, it's very, very specific to the person. So how does their skin look? If you're using all of these oils and your skin looks like, you know, you just have a lot of grease on your face, do you want to look like you have a lot of grease on your face? But if you can also tone it down a little bit as well. So it depends on how is your skin feeling, how's your skin looking.
Oh, okay. All right. You said the panel what say I see. Obi person o kasa kakra efa soap. On them share what you should delve into no busa ho asem. But soap in general, soap burner has ingredients burn there e wo soap you ma and also no emwa your skin.
I know that a lot of people stay away from like the sodium lauryl sulfates because it tends to like dry out your skin. So again, look at the ingredients. A lot of people stay away from sodium lauryl sulfate. And some people also want to stay away from parabens in their soap. So I know sulfate dries your skin out. Parabens, there's been some controversy about whether it's related to cancer or not. Also, phthalates, that's another ingredient too. Some of them have also been linked to cancer also. So those are kind of the ingredients that I guess most people stay away from.
Oh, okay, yeah, that's it. Now obi bisa say iPhone. We say a face no more sensitive than other part of the body and to lotion. You go we say nku abi na wani ma hase poko but now other areas na poko. It yes, you need no more sensitive to lotions and
I mean that I don't even know because what I can say is, and I think I said this earlier, with the skin bleaching products, no, you have those products that I'll say when you use it, your skin, your arms, right, your legs, all parts of your body will change color, but your hands and your feet. So it seems, and it hasn't like this hasn't been studied that well. However, essentially what we're saying is those specific areas, it seems your face is definitely more sensitive, but your hands and your feet are not as sensitive. Like that I can see. That I can see that.
Okay. Yeah, that's it. And my friend I'm Justice Agyei. And so no at the media Abba.
Hello everyone. Can you hear me?
Oh, Dr. J. Okay.
So now you can make up and no that I had a contribution to add. Recently, there was a Netflix special on makeup and cosmetics, and most of the time, they don't list the ingredients on the containers. And makeup a very complex. Unless our business anymore and our company anymore, most of the time, the more expensive makeup, usually safer because I know you're more regulated. But recently, no, there's a lot of products they free China eba. Because China for a brand they fake makeup or no more the Louis Vuitton and now Maybelline and now whatever makeup brand and now bohon. Into in Nipedu onoma US, there's been a lot of cases that call ER because the makeup before men in Nafe are turning into a sticky product. I want to mean from him. Oh, and I say binumu take it now I say almost skin until a very, very a complex topic, but it also making sure say toy free a store papa. So Oko Macy's and these department stores are trusted no. Mental makeup and free corner store and I say so OBI ni drum now say or say me to cheap makeup name brand cheap makeup and no one the best sell was skin no. So that's what I have.
Thank you.
Dr. Edward and ye na Agyei for na ye two Ebusia for more Ghana so for so Ghana for a time you should China products by this time so Ghana the real the man who use to makeup scene a idea ask from kakra into ye no now almost ye two homophobe Sabia almost no ebinya eso emphaso. Dr. Agyei it was CP and you call in next question no so question if you have me batra the Korea mo fanchen there are some question if you got my think say na kakra say in case I'm bo question try yeah money help because we are out of topic kakra no be we start question about racial comment question be and no yeah answer I say question Korea fanchen Obi my recommendation say black girls sunscreen and not very good for any blacks no. It will be recommendation and so be contribution of the Maya and no. Now be able to say so you should Vaseline Delia and it's a bit my harmful. Because of problem be amawana.
We love Vaseline. Love Vaseline. That is probably one of the products that we tell most people to use. So no, Vaseline every day is not harmful. And if you look at most lotions, the first ingredient for some of them is water, and then after that is the petrolatum, which is the Vaseline. So Vaseline we like that product. And I'm gonna put the sunscreen. I'm gonna type it into the chat.
A better say if you are with me with you, any put na a really chat her. Catch yes.
So CeraVe is actually a good brand for that. Black Girl Sunscreen, I think someone said that one. And then 11 by Venus. Unsun Every Day, that's another one. Elta MD is also a good one. And then Bolden. So those are the ones that I usually go to. I can also, let me type it also for those who want to see it.
Yes.
Yeah.
Yeah, that's it. Oh, Nina, what type of no be sir? I said, don't know, say contribution, but also a day, Madia. But say nitrogen also have the hydro boost, which is also for us. I think say be a contribution to question Dr. Also from Pong Busai. So be a kafa on there.
That one, I'm not that familiar with that product, but I mean, I trust the person that if it works well for them, then I'm sure it's a good product.
Oh, okay. All right.
No, I use it. It's really good. I personally use it, which is really good. It doesn't have any like white cast or anything like that. It's really good. It's Belinda.
Oh, okay. All right. That's it. Then no be person obisa and say when that clarification kakra or birthmark no. Or say you will be na the skin baby a koko a chain baby or say baby gonna bit me ayafa ho. And so giants are.
I love that question. And the reason I love that question is it makes me think about patients who have vitiligo, right? Vitiligo, said, over time, then the skin is where a baby, black, baby, white, it loses its pigment. So those patients, for example, we usually ask them, which color do you want to be? Do you want to be the dark or do you want to be the light? And most of them, what we do is we actually give them skin bleaching products so that they can lighten out, right? So if you have some areas that are white or lighter than others, and your desire is for one color versus, like usually the color people prefer the lighter over the darker, what we can do is in a controlled setting, we can give you skin bleaching products, but in a controlled setting so that your skin is able to smooth and even out. That is something that we do.
Oh, okay. That's it. And about birthmark, your birthmark, sometimes any problem be my any baby I so worried about it. A bit me janice. My wife so birthmark. I'm quite kakra. And so my money now be in horma birthmark. Be a crown so one of them. Ubian so be more unyasa unyabi. It's no say nadia ebia what baby hard repair. You shouldn't worry about it. So the doctor catch it and say a benign in need effects via our home. The mind is so worried about it. And to go back to a chart and so now the question at first so will be say being about soap these our answer. Now Mr. Doris. All right, my Sister Doris question. I come here about the Mamusa. Or say we are more realistic manner. Say when it comes to makeups, yeah. Or say a Christopher use rather than say Christopher use. I think say the I think say will be a contribute and say Mammy Amelia White a Casapi a far makeup so. I think say a break on the moon, you be a one our assuring na yenina no say a fire agreement of honor, a fire agreement and so I will. It's you be a one addition. I don't know, say yeah. Miriam, the doctor possibly be coming or honor there.
So I'm being asked, what is my personal stance on makeup? Is that the question?
That's a question, but I don't want to put you at the corner. It's me answer as a man. Yeah.
I mean, personally, I don't use makeup. Okay, personally, I've never used makeup. That's my that's my personal stance. But for those who do use makeup, I can't. You also have to know why is the person using makeup, right? I can't go and judge, and I can't go and say what you're doing is wrong, what you're doing is right. It's like taking a medication. If you want to use the medication, understand that it has side effects. We may not know what the side effects are today, right? But I'm not saying said by force because your Sunday event is you shouldn't use. I can't say that, but I can say personally what I do, and me personally, I do not use makeup.
That's it. Stems I can say Subium. The beer who do sooner. Oh, sorry, Intino. Na no yatia see. Sister Doris said there was no question I would say. My name's Dr. J. So what's up with you? Say and I say first one now, I don't know.
Yeah, first one. Sorry.
Okay, all right. Yeah, but that's it. And you come back to.
That he got from DDS. Can I
Oh, so you're not in meet your line. Oh, okay. We will say tattoos or side effects and
If tattoos have side effects?
Yes.
Yes, they do. So one of the things is the needle that is being used. We've seen a lot of, well, in the past, if you're not using a clean needle, because when tattoos are being done, they're essentially like puncturing into your skin, as entering into your bloodstream when they're being done. So if you're not careful and that needle is not clean, if it's not sterile, it can expose you to a lot of a lot of problems. Some of this is hepatitis, HIV, as well as infection, right? And then I see somebody has asked, are tattoos removable? Yes, they are. We have laser therapy that we use in dermatology to remove tattoos. And yes, they can be removed for good.
No, okay. And that's it. And look at the kakra ho say no. In the Christopher, in maybe say no. Or say to me a tree ho and so no a free ho kakra. Me say boy pie. Because maybe pastor invite say police need man be education my no cracker. So sometime you know omuchi obi. Na say so far but tattoo ka bo no no. Nya mind no mo dwene say e di pakone e. Ni pipa bonini. Na even go over hospital crana.
Gang, I don't use our gang members.
Yes, I remember Pastor Medasi. It's in the entry manifo. Say maybe say no, entry home in free home. Nadia a boy ye a point be also. And this in side never boy p.
So for so a question, the Drew so no more me.
Oh, Pastor, my protocol.
You. Doctor, you know, it's be brave. I'm say we love our skin so much in Tina Ama Fade. Yeah, abusing us and riding for young fum so and chain. Now, the doctor we catch the minister of Mammy said, dear be a would dear in ye, know, a bit me and fan count. The son and I will can say, yes, can absorb and near my idea, I confirm money and not papa no catch my question is deodorant no I use a motium ha yes no na ankajua ena na ye ma menum twitwa gu sapom ma na wo de twitwu motom ti utanase kakra na wo de akodwa wo de kodware a ayi bia pampa bia ma ho na eja ewo ba wani mu ayasi o se wo ye ko wani mu kakra na wakoto deodorant but deodorant de motom de bia me say motom so de direct e ko e bia be ko bia na e ko ya na se wo se otu yafo a na ye hu ye be ko back to yen kwensua na aha ena nema ye this round waka ho asem de but ye pese wo ye research my say nku a ye this round no say ebi wo ho na nema bi wo mu anya ya na wo de list no abre na ye hu de be ya ye betwe ho afri nema ye this round no ne anya apart from ne wo de ba ebi wo ho a ya na ye nya da age hwe ne wo mu ti ha Ghana de ense ne wo kan ye ne hia me pa na ya bo en ba nti deodorant no bi ka fa ho a nka ye papa.
Yeah, so recently there's been a lot of talk about aluminum chloride, which is a very the active ingredient in a lot of deodorants. There was some talk about this aluminum whether it was linked to cancer or not. But again, aluminum is everywhere. It's in our food. It's in packaging. Pots and pans have
cooking utensils.
Cooking utensils. And so I think that so far the studies have shown that there is no direct link ever. That does not, that there are still some people who still feel like even if studies have not shown it, then I don't want to use that. I don't want to use a deodorant that is aluminum based, and therefore will forgo using those kind of deodorants altogether, right? But there was a lot of talk about aluminum that's in deodorants being an issue. I think that Untitled, it is very powerful and it works really, really well. If you get a slice of lemon, not if I want to it does a good job as a antiperspirant. So it's something, natural products is something that I would definitely encourage. And
Thank you very much.
I will, in terms of Ghana creams, the Mercy cream, no, I have to dig deeper.
Please do that.
I definitely.
Yo, yeah, that's it.
Maybe a trim you should be paying. We had a brighter back to your chat, and so you say your couple of questions. Yeah, I'll say your answer. No, be because I say, oh, I dream be answer assembly kafa chemical pills and one pills. So be kafa one.
Yeah. So those things can, they can be helpful, but it also depends where are you getting it done from. Are the people experienced? Are they, are you going to a good posh like dermatologist to do these things? Again, these are the beauty things, the cosmetic things. If you have the money and you want to do it, please feel free. But at the same time, know that they also come with their side effects, especially if you're not going to a professional to get it done.
Oh, okay. Now, obviously, question is in Kutuna, you can't watch some. Na the wahase in your organ, na pana. Na I'm sure say yellow na sa white wine mood in a year.
I think so. The Ghanaians will be able to help me better in this question, because maybe in Kutuna Mitofri Ghana, there's always the whiter one. And I don't know if that one has already been processed. Also, yes, I've seen the whiter one is the original one. If I'm correct, the at least the lighter yellow one, the cream one, no, I think that's the original one. The yellow one, no, I don't know. It's also in Ghana too. So both are okay. I'm asking somebody here and they tell me that both are okay. So both in Kutos, the white and the yellow, they're both fine. But the answer is nice. Obiko Ghana nakachen's own friend Kutumro, because it's coming straight from Ghana. Because sometimes the ones that are sold here, have gone through some chemical processing, and who knows what nutrients have been stripped away from them.
Okay, that's a now. Me from flap question, who say in name who say a bimo ayebi a go a konkuma ayana kama atre hu enkutu. And the raw one no pal. Okay, so ntimi nchire mu yeme yehu ntino. Em say the omai process there the go ayimu and no no scent ni different akra and no need the actual scent of enkutu no.
Doma processing no.
Yeah, and say and also yeah so there. Omai bia.
Then it's not the original. But I think that
it's branded.
It's branded. Okay, it's not
because the core Ghana go visa. So my year go kunkum kama tre hu kuto aye asiri na na kama ba mi hwe bi na enisa sent nanka ren kuto wo pa.
Yeah, I mean, I see Salome has said the white and yellow is based on how it's processed. The yellow is more raw and the white is processed. But I also hear differently that so I have to dig deeper into that one. But I'm being told that the white is actually the original.
Oh, okay.
It's not the original. So the yellow is the original. The yellow is the original, and the white is the process.
Oh, okay.
No. I think I have a suggestion.
Yeah.
Pacho ka with me ato boss kakra mamia. Befro.
Yeah. Okay.
Yeah. Refache me.
Dr. Danso Pacho, Unya Kwaya, this question.
Actually, you mefro pani. You mefro. Oh, pasi busa question na wi na mafro ma don person kasa na nyina so abaso. Your questions pi o ha say nti am fanche me. Na obi busa efa chemical sunscreen ne which type of sunscreen is better? Mineral or chemical?
Okay, I think that the Nkuto debate continues.
Oh, but I don't know.
So that we can close it out. I think
Yeah.
so. Some people say so. The white or the yellow, it's based on the fruit. It's just based on the fruit that it's in, no. And it sounds like the yellow is mixed with an herb, but both are original. Okay. Which type of sunscreen is better, mineral or chemical? I think that the mineral is better. Auntie Vic also says the white is the original. Hello?
No, I don't know if it was my internet there. All right. Anyway, the name say, oh, my man was a castle man, stop here. No, wait me the number.
Yeah, Bishop Kakram person can say, I schooled in northern region and and omuyesa in Kutoya hona a free bus south Ghana. Na yellow one, yeah, I think so omudi and go for to make it look good to catch customers. But for the white one, the Jabane woman and yellow, so share a nut na a Jabane one and yellow. I think it's or they're light white, and on the original, but for yellow no is for appearance to catch. So they add some palm oil to it to make it look good.
Yeah, mama, it was a part. Things say, contribution is silly, Bibia. It was okay. Nemefre opinion or person Casano, but was found in the bra. After you got charged na they are running up.
Okay, Dog Mpacho, me question here. Okay, to me. First one, the person bisa say medical scientists, they are saying say they na my bofra doctor or they are saying say it's say yeah free Africa na ye ben equator sunlight in the need to person be having ye bahasi ye bakrum haya ye lusu samelon na ya better have be 10 years 20 years we tend to get more cancer. Is that true? Any truth in it?
Well, the melanin that you have in your skin is determined by your genetics. Okay? So it's not going to change by you moving to the United States. That's what I say.
Okay, Doc. Would disprove what the medical scientists are saying?
That because we are not in Ghana anymore, we are losing melanin by being in the US and therefore are at increased risk for cancer.
No. And so, one question, Nancy.
Okay.
Say, ye bahaya. Obi betimatna. Emma, what menya enough sunlight. Because of weather obi betimatna. Or call a juma or to make a mo. Or call office or to make condition. 7 more moko school amanya mo kakray. Nti be a 6 months, 1 year time be grana area grant on so that or sweated. This is what the medical scientists are saying. You would disprove woman as what are you saying?
I would like to see their study. If you can show me their study, okay. I will be more than happy to read it and analyze it.
Well,
because I don't.
Yeah, my memory kakra wa say. Said your organ, we study be our work on who study no. And I study piano, say a bigger tune, say peer reviewed, and say, who study, let's say a peer review or book. It's no.
I mean, my beautiful
first question is come to those kind of question at was so am I.
Okay, second one, the question. Aseda na mede ma osofo ne nyimpanifo titiriwo na mabofra ise ye che wo krom han so nyankopon so ye adom se wo Dr. Du Michael na mabofra nyame hia mo ye pa ye ni asomo na ye funa akra we free mobile de Prophet Ernest ehye ho bo the Bewada at the Jesse Fred say, hey, Koku can home, a boyfriend never a doctor, or chair dear day, but Tino pa and Yamishiano.
Amen. Amen. Upon you, was amen.
So, amen. Uncle, dear, not also what you're saying, no, right? Because say a free Ghana, about USA. One thing that we miss out on is vitamin D, right? Vitamin D, which is very, very important. Okay. However, there aren't any studies that link, or at least I haven't seen any that link lack of vitamin D to cancer. Okay. Lack of vitamin D is associated with diseases like, I think my brother was talking about it yesterday, multiple sclerosis. That's one of the diseases that's linked to vitamin D. However, I don't think I have not been made aware of any studies that connect vitamin D to cancer per se. So I would really love to actually see that study and kind of figure out where they're going with their how the study turned out and stuff.
Dr. Edwase. Bisa na Dr. Owusu Agyei nso apagya na nsa ebi a so ka bi kakra fa ho a betimi akasa.
I guess not me pese me hu me pese me ten a question I say ufri Ghana na say wo ba ha no ma the only thing they change here the amount of sunlight awunya, which means that melanin in our body muno in change. And I think so say see me call Ghana na me back and I say me call Mexico for vacation na me back na my YouTube it only thing a different there me sunlight and me nya and I me one melanin and one me body me it produce melanocytes produce melanin emma me to me black in the nipa bi o biano or different concentration of melanin Ghana for ya we the same it be a cocoa and it be a tuntum depending on how much sun abenyano that determines how active our melanocytes juma and it determines how black I will get it but I don't know say it changes over time. I know say or sunlight unyano and it determines how it coming out. So even white people know say oh do we call Florida for 2 months or back happens why you too even though
they tan
even though omunye a black at say and that was the only thing I wanted to add.
Okay, this is also the was you better na answer questions na what chat no na ya run it up not Dr. Thompson so ebusa asem bi say in your experience in medical science no o sha the way see be etete be said dermatologist for no with regard to black skin no munya nimdie pa ho ye I would recommend the say be a NK black skin and ke pet idea a skin one ke be black dermatologist and
Yeah, so and that's the thing. The sad thing about dermatology training is all of our textbooks just show white skin. So a lot of the same diseases, we don't even know, we don't really get to learn what it looks like in dark skin. But there are some Black dermatologists out there who have made it their mission to make sure we learn and we see these diseases on Black skin as well. And to make sure we educate not just ourselves, but everyone. That way, if a Black person comes to you with an issue, you're able to say, yes, that's how psoriasis looks in a Black person. That's how eczema looks in a Black versus a white person. That's how this disease or that disease looks. So definitely, I would encourage you, onset, it's always nice when you have a doctor who understands you, right? Like when you're kind of from the same background in a way. So I would, yes, if you are able to find a Black dermatologist when you're in need, definitely, I would encourage you to do just that, to definitely seek them out.
Like you, thank you.
Dr. Yedawase. I think I come last question. So when you alata samna, Obi Busa say you're good for our skin.
That's the other one that I need to research into because I don't know what the exact ingredients are.
Okay. All right. And anytime be a binya ho ayibiana amaya son ati. But I think say you answer most of the questions now about chat no so no. Na Dr. Thompson Ibisa say o kind of in case some person be who personal.
You know, the funny thing is I actually haven't even started my dermatology training.
Yeah.
God willing, I'll be starting because I have to do a year of internal medicine first. So I'm finishing up my internal medicine year, and then I'll be moving to Johns Hopkins to do the dermatology training.
Yeah, that's it. I mean, so the kind of work about on what's over walk. But say in case it will be like you also the dermatologist also offer what with recommend the amount.
Yes.
Oh, okay. That's it. And a bomb pie mount. So I'm going to come about some dream. I did for me. Did say questions now? What chat one answering in every. Or in case we are many buffer obedience so maybe the papa no or lies so dear with my coin no me to Saudi and that's in the question pertaining to a discussion there. I think say answering in area. Okay. Ubi a piano sama kwa kwa kasa we are na a discussion abewe 1+ but with my kasa.
My patrona obi minimum be also on you bleach to clean namotu mohonum. I guess it's the other alternative other than I can try the no so on the bleach no use nam person who say and no you safe and I'll claim who say no so cent na basically cent be and I say it breaks the sweat or the perspiration. It's in nam person who says bleach using during shower or whatever time we'll use to know, is that safe?
And is this bleach Clorox?
Yes.
So that product is not for your skin.
Okay.
So that is not safe. Those products are for, I believe, clothes and sometimes some surfaces. So please do not, that is you inviting danger for yourself.
Okay.
So I would not recommend it.
Thank you.
For the armpits, I'm telling you, the lemon It works wonders. And it's natural.
Oh, okay. Dr. Marian Owusu Agyei, there was a prior and education what they are brave. So passing Kakan, Nipabia, or we are Sibiano, skin Uniano. It say Sika Kotunku say Edesra. Tine there was a war addition what me a day a brave. I miss Laupi. No go into a dream, no me waging. Abra Kusu is Yadi. As my pastor climb my pastor Abano. Say a Friday, and so no, your boss are at the way so abaso. Ya could you almost say almost team the kind home and may see ye addition. If free Sunday no, a bit drew and net Friday, you know, at the way by lie so any ye a bisiadi, a brow moon ye a country for. Ye were in my maid Doris Kufo, the be all lie so out. This and the parents will also be. You were a papa Stephen Boatin, you were Gloria Nimakon, you were Samuel Otre, you were Sister Joyce Owusu. Also, I was what. This is for P also. I be a man, sign come with our munina, SDA for, but none to me, no, myself, my dad, Jia Baswa, Munina, a bit addition. When say Sister Letitia, so I was so. Also, not only I addition from Sunday, my minutes, or room crop now, no fresh also. Which means now, Namboa, what's Navia, a better Washington, Munina Masamra, Namuni, Immissia, addition. And yet, Major Mama, Pastor, na the pastor, so I admire.
So, I'm saying, on behalf of our sorry, Nina, better Dr. Fui, I see a profession via. Yes, when you who can now to me a year. Yamina, a mama domono, Mom, yes, I do. If it's a gift, no, ultimately, always be a more unique gift. Said the Shirams. Omo ni pounds that journey abutre. But otherwise, nipa yarea. Or no one able to fire area brand on but I know frustrated with you, the doctor. Obi Tizania Wukin, Obiako using Yaman and Nimina away. Oba Hona doctor or train best 1 month now to mean Sani area, not the Bubu, never fool. Yamima Mwadum, any abutre, Ninyan Sabe, Namon Famoye. For yani you frustrated, yani your problems, yana your conscience. Ni never be brave. Obi a yarofo na aboka se na onye okay. Nye no mas. Never be brave hano. Nti edamo ase. Na biafo me a omo kire yen. Yem omo yem fa moye bra. Na moye. Wo product bia enya okan ya. Kotugu. Na enya apomuden. Because yare de hard ni bibi. Cancer no bebre no nema chemicals no bebre no so second. Na me moye na ne yati emfanya doctor for your boy so yada was. Ene ebre bia ya apomuden a utai echi ebe boye. Yo ene ye be bon pai. Se bibi o hobi mu dia misananso fama ye.
Yeah, as a vampire, most will be attesting me say what's not program no time be.
Okay.
Yeah, into what's not your bay or some memenda Sabbath. Yes, if we are now 3 p.m.
Okay.
A last presentation. And no topic bear me Sunday Akabuma, you know, a last presentation, no. The Bekasa Afai, Crown Crow, Yarion. Diarrhea is a chronic illness. Everywhere see one ya and one a tomusa when you say diabetes step, chronic illness. How to deal with it. Rebecca Afa said you make end of life decisions. Rebecca sa Afa home. Intino Adofo Yankopon Boa China Nsuno me yem life sunimity. Which are the 7:30 deal. A 3 p.m.
Okay.
But before 3 p.m. Sabe commit that asway. It was our first a mom phone in say 9:30 na ya asore hase be ya kosi 1 na e botre so a na be ye atumi program no yense no so ti edamu nyina amase e pastor bije mma mo chira so amaye
okay awofo no so a mo nyame aka bo matete doctor fo so nyame hira mo bebre me hira mo ma ye mo mpaye eja paye da wase umida na umai na mo wadum ni nyansa ne nimdia wodi ama om titru enwumre Dr. Maria na wo mo akyerɛkyerɛ yɛn nyema bebre a ye sei ni pedua soronko a wodi ma yɛn fa yɛbɔ ne kyɛ yɛn sɛnea yɛtie bia no wona woyɛ yɛn saa nanso ya na yɛhwɛ binom na yɛpɛsɛ yɛ te sɛ wɔ mo sɛnka yɛ appreciate ni wodi ma yɛn a ka any problems bia nti enwumre yi in any way I abuse your body, me and skin, which is the temple of your Holy Spirit. Na a free numerical, yenye and sacraya and shishepa. Na yenye conscious, I did be a yede kind of pedia when I say a bequaco prying and I be boy. Say the adopter fui shaunsa. The free Sunday numere, a busy and then numere and or more casachres, and or chance on betos. Esrenim die bebre esre ohwe sopa na obambo de amawom se be ya adwuma kase ese o mafai o munya o hawo bia ubekọso abi o madwene ne o talent no motumi de aye adwuma ahye wani onyam na ebeboa akraje nsoso o bebo de befa so ma akraje adwuma no bekọso because eventually say yetminya apomden nifedua yaresa na yenya enkwaje a still no anwie peye ndi anyumre bo doctor fu nyansa ne nimdie a wom de enkwaje ne abofo miensankras ebe ka wom ministry ho se be ya wom boa physical health no na nipa spiritual health so eno so wom ye ho dwuma sira wom bebre ne ona wofo ne ona busu nyina wom kokom mpaye tie na ye ma wom afi ye de ye yufu ne ye mrante bebre ko school sha won so biom nyina adwene mu na wom a da chi nso betumi aye professional career bia fo ko duru ho Uma pesa ye engineers, uma pesa ye a lawyer for, uma pesa also for teacher for, nurse for career bia profession bia you put young adult to the on and so ya on person on ye na radi mom nyansa ne nimdie na omo nso abeye mpanyifo abeboa wadwuma ene abusua ene wasaf anadwo ye bekwa kodeda ye nim ye ho so hwe una obetimi atotu ye punum abo ye ho ban ye nsafo ade nipa bonifo pe na honhomfine o ma kaka ho de This is where we are boy and who ye could they ye only a dajin ye jadi go una say. Problem be a ye dibe ura whom dem. A radian na why ye who be the biaman. At the patching na ye son sorry bazumi so ya dawasi. Ye they have department for penny down soon in the team in Ashaunsa. The Dakoswa mom yansan in him dear guide. Omnian she shepa. My first Ghana suffer. Impony youngest in Impon of America henina. Nyina yetumi atia pomden hihye atsiesie ho aboye braye cause a healthy family makes a happy family the other was say nwumrei ani na otwi nyina wo Yesu di mu amen
amen ene agidifo ene yekodai homeda gwa no onhwe so omade panchien omaya hoden na wo kyerɛ ne penso a onkemum ne nsa ntimi ansum no unsesrai no ntenim kyerɛ akwensa hodo nyina mu amen
amen
announcement ni ho dia ene ye ka mespa
ye identity Yehowa nhwe me no ntem amen
amen amen
Asasi su miri kumebi Gasi ya mwinyati ni emuwe ni jashe ni pame Onuya ibesi use